Going to the doctor is enough to make anyone anxious, especially if there's a serious medical condition going on. While contemporary medicine has made some great strides, some treatments are downright weird. Here are the creepiest modern medical practices. Electroshock Therapy. Better known as electroconvulsive therapy, and starting in 1938, ECT was originally seen as a barbaric way of treating patients. The process involves shocking the brain with hundreds of volts in order to induce a seizure and treat mental illness. But before you breathe a sigh of relief, know that the American Psychiatric Association reinstated ECT as a treatment in 2001, and it's been used to treat chronic depression, with a few thousand treatments happening every year. Cryotherapy. You might think cryogenics are only reserved for science fiction or Austin Powers, but it is a very real process that is being tested for regular human use. Cryotherapy is commonly used to treat diseases like skin cancer. It involves applying liquid nitrogen to the affected area. Instead of feeling very cold, it actually burns the skin, literally burning the cancer off. But it is no miracle method, as there are still burn wounds to deal with after the fact. Craniotomy. Getting a craniotomy is basically getting a hole drilled into your head. This medical practice has been around for over 7,000 years. Despite becoming more refined as time has progressed, there is still something frightening about a person drilling a hole in your head and treating your brain so easily. Whether it's treating brain tumors, aneurysms, or drilling a brace into your skull, having the location of your consciousness so easily invaded can keep anyone awake. The Gshot. If you're a woman and you know where your G-spot is and it's not performing to your standards, you may want to consider getting the Gshot. The shot is an injection that goes directly into the G-spot and increases its size so that it's easier for the man to find this spot that gives so many women pleasure in the bedroom. The thought of increasing the size of the G-spot with artificial chemicals is pretty creepy, even if it is a quick procedure. Laughter therapy. They say that laughter is the best medicine, and in the 1970s in Mumbai, Dr. Madan Kataria perfected a therapy that includes throwing your hands in the air and laughing like a maniac. There are over 5,000 groups around the world dedicated to this practice. So if you see a random group of people throwing their hands in the air and laughing like a bunch of crazies, they're just doing their therapy. Lobectomies. First emerging in the 1930s, lobotomies were seen as a barbaric way of treating people with mental conditions. One of the most horrifying lobotomies ever performed was recorded, with a psychiatrist using a hammer and an ice pick and stabbing the pick through the eye socket of the patient and wiggling it around until the right part of the brain was hit. If you think that lobotomies are permanently gone, then you would be wrong. They've been renamed lobectomies, and they're currently being used to treat epilepsy. Maggots. If you're squeamish at all about bugs, then maggot therapy will be beyond creepy crawly for you. You would think the medical world would have progressed and developed something different to treat dead flesh, but apparently maggots are still the premier way of eating away dead flesh and cleaning your body. If your wound is having trouble healing after surgery, you may be feeling some creepy crawlies in your skin. Parasites. Apparently, hookworms are effective in treating allergies and autoimmune disorders. However, hookworms are parasites, and you would have to level yourself with unsanitary conditions and allow a living creature to live within you. There have also been talks of ingesting tapeworms to help deal with obesity, but the results of that are usually fatal. Doctors are testing the hookworm theory by injecting the parasite in people and recording the results. Bee stings. The venom from a bee sting has been used for thousands of years to treat different ailments, and it is still being used today. Granted, some doctors will prescribe milked bee venom, while other practitioners will use live bees and stab their patients with their stingers. Apparently, bee venom has been used to treat ailments like arthritis, herpes, and it's even considered to be a possible cure for cancer. Symphysiotomy. If the idea of getting a cesarean section creeps you out, meaning getting a baby cut out of you through your stomach, then you might want to check out the alternative. Symphysiotomy is the practice of widening the hips in order to get the baby out of the mother. The process is painful, and if appropriate medical equipment isn't available, then doctors get out the saw. It sounds like something out of the Saw franchise, and victims from the 1980s are coming out with their own horror stories. Thanks for watching. Hopefully you're now suitably creeped out. If not, here's a couple other videos for you to check out, and please don't forget to click like and subscribe. Thanks.